If you're over 60 and still masturbating the same way you did in your 30s, you could be causing real harm to your circulation, your prostate, and even your nerve function. And I know this isn't something most men ever hear from their doctors, but it's something you need to hear. I'm Dr. Annabel from Prime Wellness, Aging and Vitality, and in this video, I'm going to show you exactly how to adapt your self-pleasure routine after 60 so that it supports your health instead of damaging it. Before we go deeper, take a moment to subscribe to this channel because here I share the science, the strategies, and the solutions to help you age with confidence, energy, and vitality. And I don't want you to miss any of it. Now let's get honest. Over the years in my practice, I've met countless men who were too embarrassed to ask about masturbation, even though they were worried about changes they noticed. Many thought they were the only ones struggling. They weren't. And you aren't either. This is a universal reality of aging, and there's no shame in it. In fact, talking about it openly is one of the best ways to protect your long-term health. So if you believe in honest, no-nonsense conversations about aging, subscribe now so you can keep learning with me. Here's what most men don't realize. Masturbation after 60 can either support your body or slowly harm it. The difference comes down to three things: your technique, your frequency, and your awareness of warning signs. If this sounds valuable already, give this video a like and make sure you're subscribed so you don't miss the rest. Now let's clear up one myth straight away. Masturbation itself is not unhealthy after 60. In fact, when done gently and mindfully, it actually helps support prostate health, keeps circulation flowing, lowers stress, and even helps preserve sexual function. So no, you don't need to stop, but yes, you do need to adapt. And if that gives you reassurance, subscribe right now, because that's what we're all about here, guiding you with the right adaptations at the right stage of life. Let's talk about why your approach must change. After 60, your body has gone through several key shifts. Your testosterone has been slowly dropping by about 1 to 2% every year after your 30s and faster after 60. Your blood vessels have become less elastic, which makes erections slower to develop and harder to maintain. Your nerves have become less sensitive, meaning it takes longer for signals to travel between your penis and your brain. And your recovery time has increased dramatically. What used to take minutes in your 20s now takes days in your 60s. And here's where men often make mistakes. They ignore these changes and keep using the same old techniques. And that's when lasting damage can set in. If you want to keep protecting your body, make sure you're subscribed so I can continue walking you through these changes. Let me share a story. One of my patients, let's call him James, was 67 when he came to me. He complained of numbness in certain areas of his penis and difficulty enjoying intimacy with his wife. When I asked about his habits, he admitted he was still masturbating every day, gripping as hard as he could because he just couldn't feel anything otherwise. Over time, that pressure damaged his nerve endings. With adjustments and the right approach, he improved, but the damage wasn't fully reversible. That's why I'm telling you this now, because prevention is always easier than repair. And if you never want to end up in James's situation, subscribe right now so you keep learning safer ways forward. Now let's break down the three biggest mistakes I see men over 60 making. The first mistake is using excessive pressure. As sensitivity decreases, men instinctively grip harder. But the penis isn't built to withstand years of crushing force. Inside are delicate blood vessels, spongy chambers that fill with blood, and nerves that transmit pleasure. When you grip too tightly, you crush these tissues. Over time, this leads to numbness, reduced circulation, and what's called death grip syndrome, where a man can only orgasm with an unnaturally strong grip but struggles with a partner. That's a heartbreaking cycle I don't want for you. If this information is useful already, subscribe now because I have an entire series planned on protecting nerve health as you age. The solution to excessive pressure is what I call pressure titration. Instead of gripping harder, start with the lightest touch you can tolerate. Give your nerves 60 to 90 seconds to respond. Your nervous system isn't broken, it's slower. Allow it time. Increase pressure only gradually and never squeeze so tightly that the shaft is completely compressed. Think of it as a massage, not a mechanical action. If that makes sense to you, subscribe right now so you never miss the safer methods I'll be teaching. The second mistake is masturbating too frequently. Many men try to keep up the daily or even multiple daily habits of their youth. But after 60, your prostate and hormonal system simply can't keep up. The prostate produces about 30% of your semen. It needs recovery time. If you keep ejaculating too often, you force it into overdrive. The result? Inflammation, discomfort, and sometimes enlargement. Hormonal rhythms also get disrupted. I've seen men develop what I call ejaculatory fatigue syndrome, where each orgasm feels weaker, takes longer, and leaves them drained instead of satisfied. That's not the way to age. So what's better? For most men over 60, 2 to 3 times per week is the sweet spot. That allows the prostate to recover, hormones to balance, and arousal to build. Some men feel best with even less, once or twice a week. Quality over quantity is the rule now. And if you want to learn the science of timing your intimacy for maximum energy and pleasure, subscribe right now. I'll be covering that in upcoming videos. The third mistake is going without lubrication. I can't stress this enough. After 60, testosterone decline means less natural lubrication. The skin of the penis also thins with age, becoming more vulnerable. Dry friction can cause microscopic tears. You can't see them, but bacteria can. And that's how infections and chronic inflammation start. Some men even develop scar tissue from years of dry friction, leading to permanent sensitivity loss. You don't want that. The fix is simple. Always use a high-quality, unscented water-based lubricant. Apply it at the beginning, not as an afterthought. Look for formulas free of parabens, glycols, or heavy fragrances. And avoid oils if you use condoms. They break latex. This one change can save you from years of irritation and discomfort. If you've never thought of lubrication this way before, subscribe now, because I'll keep sharing the hidden yet simple adjustments that protect your health long-term. Now, let me give you my complete protocol for safe, healthy masturbation after 60. I call it the CARE method: cleanliness, appropriate technique, respect for timing, and evaluation. Cleanliness means washing your hands, creating a private, comfortable environment, and choosing positions that don't compress nerves. Appropriate technique means starting slow, applying lube first, using light pressure, and alternating grip to avoid strain. Respect means giving yourself 15 to 20 minutes and spacing out sessions every 48 to 72 hours. And evaluation means listening to your body, watching for pain, numbness, swelling, bleeding, or urinary changes. If you notice these, seek help. Early intervention saves you from bigger problems. If you appreciate having a step-by-step method like this, subscribe right now, because I'll be creating more practical guides just like it. And let me be clear, there are warning signs you should never ignore. Pain lasting longer than 30 minutes, sudden numbness, swelling, unusual discharge, burning during urination, bleeding, or a sudden inability to get erections when you could before. These are all red flags. Do not brush them aside. See a doctor. I promise we've seen it all. You are not alone, and you should not suffer in silence. Subscribe now, because I'll be teaching you how to recognize and respond to health signals before they become emergencies. Here's the truth. Masturbation after 60 can absolutely be healthy, satisfying, and deeply beneficial, but it must be adapted. The rules now are simple: slower, gentler, less frequent, and always with lubrication. This isn't about performance or proving something. It's about care, respect, and maintaining your health. And you deserve that. So if this video helped you, subscribe now to Prime Wellness, Aging and Vitality. Share this with a friend who might need it. And remember, you have the power to age with confidence, comfort, and dignity. And I'll be right here, guiding you every step of the way.